Good evening, everyone. So, my next video is on the topic paracetamol poisoning. My next session is on the paracetamol poisoning. Now, paracetamol poisoning, it occurs when there is acute ingestion of more than 7.5 gram of acetaminophen, which is the other name of the paracetamol. Acute ingestion of more than 7.5 gram of acetaminophen or repeated use of the subtherapeutic, supratherapeutic doses, they can result in toxicity. Paracetamol poisoning can occur in children also and in adults also when large amount of paracetamol is taken, like 10 to 20 tablets of the paracetamol are taken. So that can result in paracetamol poisoning, which can be suicidal or it can be accidental also. More so in children with low hepatic glucuronide conjugation. Means low hepatic glucuronide conjugation means the pathway of the paracetamol metabolism is like this, that 99% of the paracetamol gets converted in by the glucuronide conjugation into the inactive metabolite, and which is excreted in the urine, and 1% it is metabolized by cytochrome P oxidase enzyme to the toxic metabolite, that is NAPQ, that is N-acetyl paraminobenzoquinolamine, which is the toxic metabolite. And so when there is low hepatic glucuronide conjugation, more NAPQ will be formed. So paracetamol poisoning can occur in children. And the serious adverse effect of the overdosage of paracetamol will be, there will be hepatic necrosis, renal tubular necrosis, and hypoglycemic coma can occur. There can be hepatic necrosis, liver damage can occur, renal damage can occur, and hypoglycemic coma can occur. Now, hepatotoxicity in adults, hepatotoxicity may occur after ingestion of a single dose of 10 to 15 gram of acetaminophen, which is 150 to 250 milligram per kg. 10 to 15 gram of acetaminophen can result in the liver damage. Hepatotoxicity can occur. Doses of 20 to 25 gram are more potentially fatal, means they can result in death. Conditions of cytochrome P oxidase enzyme induction, heavy alcohol consumption. Means there is more cytochrome P oxidase enzyme induction that can lead to more formation of NAPQ, and which is the toxic metabolite, which reacts with the self-hydral groups of enzymes, DNA, RNA, and other proteins, and which will cause damage of those enzymes and proteins in liver and kidney. So doses, they can be more fatal. For glutathione depletion, when this glutathione depletion means the sulfhydryl groups, the NAPQ, it binds to the glutathione, which is generated by kidney, by the liver. Liver, it produces by the metabolism, produces glutathione, which is triamine in structure, and it has sulfhydryl group attached to it. And when glutathione of the containing the sulfhydryl group is generated more, it will combine with the NAPQ and it will be excreted in the urine as the non-toxic metabolite. But when depletion occurs of glutathione in fasting or in malnutrition, it can lead to susceptibility of the hepatic injury. There can be more hepatic injury can occur, which is documented with doses in the therapeutic range. In the therapeutic range also, it has been seen that glutathione depletion occurs in fasting and malnutrition. So more sulfhydryl damage will be there, sulfhydryl group damage of the RNA, DNA, proteins, and enzymes of liver, kidney, etc., and other organs. Mechanism of action is the glucuronide and sulfate conjugation pathways become saturated. Means it overdose, what happens is in place of the 99% of the paracetamol, which was metabolized by glucuronides and sulfate conjugation, 90% gets 90% gets converted into the non-toxic metabolite, and 10% gets converted into the NAPQ. That is an N-acetyl parabenzoquinoamine, and by the action of CYP enzyme, cytochrome mediated and hydroxylation to form NAPQ. And it is highly reactive, annihilating minor metabolite. This is the minor metabolite, and it causes the damage of the sulfhydryl groups, and it is rapidly is eliminated rapidly by conjugation with sulfhydryl groups and excreted in the urine. It will combine with the glutathione if the glutathione excess is there. So it will be excreted in the urine as non-toxic metabolite. Toxicity manifests only when glutathione is depleted to a critical point, like in liver damage and hepatic failure, glutathione the stores get depleted. So then a damage can occur of the liver, kidney, and other organs of the body. NAPQ binds covalently to cell macromolecules, leading to dysfunction of enzymatic systems. I've already told you it will bind to the sulfhydryl groups of the enzymatic systems and other structural and metabolic disarray. And in case of paracetamol overdose, hepatocellular levels of glutathione becomes depleted. Means when the overdose occurs, the glutathione stores they get depleted. Um, because more NAPQ, more NAPQ is formed, it will be combining with the glutathione, and in overdose, the glutathione the stores they get depleted, and which will be rendering the hepatocytes highly susceptible to oxidative stress. There will be more oxidative stress to the liver. Symptoms are that during the first 2 days of acute poisoning, it reflects gastric distress. There can be gastric distress like nausea, abdominal pain, anorexia, and there can be potential seriousness can occur. And plasma transaminases become elevated. Liver damage occurs, so plasma transaminases they get elevated in 12 to 36 hours and peak 72 to 96 hours after ingestion. It can occur. Clinical indications of hepatic damage manifest within 2 to 4 days of ingestion of toxic doses. Now, hepatic damage occurs and it occurs manifest within 2 to 4 days of ingestion of toxic doses, and which will present as the subcostal pain, tender hepatomegaly, jaundice, coagulopathy, and encephalopathy, and that has the poor prognosis. Renal impairment and frank renal failure can occur, hypoglycemic coma can occur, and in non-fatal cases, hepatic lesions are irreversible over a period of weeks or months. Management, now coming to management of the paracetamol poisoning. Acetaminophen poisoning, the rheumatoid Matthew normogram relates the plasma levels of acetaminophen and time after ingestion to the predicted risk of liver injury. Means the levels of acetaminophen and time after ingestion to the predicted risk of liver injury is noted. Severe liver damage may be seen when plasma concentrations of acetaminophen are more than 300 microgram per liter at 4 hours, and minimal damage when it is less than 120 microgram per liter at 4 hours. Means when it is more than 300, then the damage will be there, liver damage, and if it is less than 300, then minimal damage will be there. Less than 150 microgram per liter, that can lead to minimal damage of the hepatic tissue. Early diagnosis and treatment of acetaminophen overdose is essential. We can give activated charcoal in the paracetamol poisoning within 4 hours of ingestion. It will decrease the acetaminophen absorption by 50 to 90%, and it is a preferred method of gastric decontamination. It does not interfere with absorption of antidote. Means antidote, like we give N-acetylcysteine, so it will not interfere with the absorption of N-acetylcysteine, but it will impair the absorption of paracetamol 50 to 90%. So gastric decontamination can occur, so paracetamol poisoning can be reduced. Gastric lavage generally is not recommended. Now, N-acetylcysteine, it is the therapy should be instituted in substituted cases of risk of suspected cases of risk of liver injury before blood levels become available. Means we can give immediately N-acetylcysteine if there is a suspected liver injuries there. If with treatment terminated, if results indicate that the risk of hepatotoxicity is low, and then we can stop the treatment if it comes to know that the risk of hepatotoxicity is low. N-acetylcysteine functions by detoxifying NAPQ. Now, N-acetylcysteine, it is also having the sulfhydryl groups in excess attached to it. So it will combine with NAPQ and N-acetylcysteine, and it will make it a non-toxic metabolite. And it will conjugate directly with NAPQ, and it will be the glutathione substitute. And even in cases of established acetaminophen toxicity, N-acetylcysteine may protect against extrahepatic injury by its antioxidant and anti-inflammatory property. It is also having the antioxidant and anti-inflammatory property, so it can lead to improvement of the extrahepatic injury also. Now, N-acetylcysteine oral loading dose of 140 milligram per kg is given, followed by the administration of 70 milligram per kg every 4 hours for 17 doses it is given. Where available, the intravenous loading dose is 150 milligram per kg by intravenous infusion in 200 milliliter of 5% dextrose over 60 minutes, followed by 50 milligram per kg by intravenous infusion in 500 milliliter of 5% dextrose over 4 hours, and then 100 milligram per kg by intravenous infusion in 1000 ml of 5% dextrose over 16 hours. Means it's after a period of time we are administering the N-acetylcysteine to have its effect. Supportive care for management of hepatic and renal failure, if they occur, that can be done. And intubation, if the patient becomes obtunded, can be there. And plasma glucose, if there is hypoglycemia due to liver injury, so we can give glucose also. And permanent liver hepatic failure is an indication for liver transplant. And we can see that the patients who are suffering from alcoholic liver disease, in those patients, the glutathione stores are already depleted. So we can say that the NAPQ will be more effective if paracetamol is taken in large doses. NAPQ will be more formed and it will be more toxic if in acute acute liver disease, in alcoholic disease. And alcohol also induces the cytochrome P450 oxidase enzyme. So more induction of the cytochrome P450 oxidase will lead to more formation of NAPQ, which is again attached to the sulfide groups of the various organs of the body, various enzymes and proteins and RNA and DNA, and cause damage of the liver, kidney, and it can cause hypoglycemic coma. So we can say that alcoholic liver disease is very much susceptible to paracetamol poisoning, a person with the alcoholic liver disease. Thank you, and please subscribe to my YouTube channel, Dr. Nitika Hans Pharmacology Discussion, if this video appears useful. Thank you. Happy learning. Stay safe, stay healthy. Thank you.